Epilepsy is a neurological condition which affects the nervous system and is also known as seizure disorder. Dr. Faisal-Qazi of San Antonio Community Hospital in Upland tells us about the treatments available to control this disorder.
The best way to understand epilepsy is by definition, it's your vulnerability to have recurrent seizures. In other words, it's your vulnerability of your brain to have multiple seizures. Seizures come in various forms. The most obvious form of seizure we know is shaking spells. We call them grand mal seizures when the entire body convulses. But the more subtle type of seizures is what we often are looking for, because they suggest, sometimes they indicate the parts of the brain that may be abnormal. What are the subtle type of seizures? The subtle type of seizures can be a simple staring spell. It involves an alteration in a person's consciousness. A confusional spell, for example, could be a seizure. So those are subtle forms that are often missed. The workup involved at that stage, when we are determining when somebody has their first seizure, they should have, say the least, a number of minimum of 2 tests. One is some imaging of the brain, pictures of the brain, either in the form of CAT scan or MRI, preferably MRI of the brain, and EEG, which is an electroencephalogram, which detects the brain wave patterns. Those 2 tests are basically helps us define what sorts of abnormalities that may be present in the brain that could put a brain at risk for further seizures. What we described as a basic routine brainwave test, we call it EEG. The recent advances in technology has actually allowed us to do the same analysis of brainwaves over a prolonged period of time. So now we have the opportunity and technology to be able to put somebody in the hospital, for example, and watch their brainwaves overnight. So we do overnight EEG over 24 hours. We can do it for up to 72 hours to 5 days till we really figure out what the nature of abnormalities they're having. We also have, in addition to that, we can do video EEG on top of that. The video component of it allows us to see the seizure. We can capture it, record it on the video, and then we can correlate the video to the clinical picture of the seizure we capture on the video to the brainwave changes on the EEG, and helps us determine where these seizures are beginning from. The treatment options are variable at this stage of the advances in technology. We have our basic bread and butter medications. We have our old medications that are good medications. And in the last 10 years, we have seen really about 8 to 10 additional medications that have come out in the market. So our options of choice of medications is incredibly diverse at this stage, which is a good tool for epileptologists to have. Beyond that, the current technology has helped us identify the areas of onset of seizure activity within the brain. That has led us to determine whether those particular areas of the brain can be resected surgically. And the success rate for surgeries is incredible. It's quite remarkable, actually. And if somebody doesn't qualify for surgery, we have devices that behave like, think of them as pacemaker for the seizures. This particular device is called vagus nerve stimulator. We have individualized patients that qualify for them and tend to do good on them.